Part 2, vascular lesions, dramatic appearance but harmless. So these are the so-called things like port wine stains. You get them in children just born, parents very upset or worried, nothing serious. Infantile hemangiomas, raised red or purplish, hyperplastic, many go away, but if obstructing visual airway, then treat. So in other words, nothing to worry about, just keep an eye on it. Nevus, flammeus, port wine stains, again, you can read it, nothing serious. Nevus araneus, bright red, faintly coloured, pulsar vascular lesion, central arteriole with slender spider legs. Pyogenic granuloma, again, looks dramatic but isn't serious. A flesh, voice or crusty scarlet vascular nodule, proliferating capillaries. Lymphatic malformations, well, I've listed different types here. Dilated lymphatic vessels, usually observe these. Patients get swollen legs. Remember, non-pitting edema from swelling from lymphatic malformations. Bullish conditions. Now, these can be dramatic and cause a lot of stress to the patients and actually be life-threatening. An autoimmune disorder, basically the skin forms these huge bullish eruptions and the skin just starts shedding or separating. Diagnosis, skin biopsy, treatments, corticosteroids, long-term maintenance, for which variety of drugs can be used. Got to know about this Nikolsky's sign, lateral pressure on skin next to a blister causes epidermal detachment. So just touch it next to the blister and it just starts peeling off. See, the sign off a negative in pemphigoid but positive in pemphigoicus. So, bullous conditions, dermatitis, herpetiformis, cutaneous manifestation, gluten sensitivity, you'll hear a lot about that, particularly in regard to GI tract, clusters, intensely pruritic vessels, autoimmune diagnosis, skin biopsy, epidermolysis bullosa acquista, a chronic inflammatory mucocutaneous condition with blistering and skin fragility. Again, with many conditions, it's either clinical, diagnosis on clinical observation or biopsy. You can see the medications used there. Linear immunoglobulin A disease, an uncommon bullous disease for bullous pemphigoid dermatitis herpetiformis by linear deposit IgA. Again, it's for the ones who are getting gold medal in the class. Pemphigus foliaceus, a genetic benign blistering condition. Pemphigus vulgaris, serious, can be fatal, often need to go to the hospital. Uncommon, potentially fatal autoimmune disorder, intradermal blisters, extensive erosions, healthy skin biopsy, dramatic. So these can be quite distressing for the patient and can be very serious. Cancers of the skin, remember? We've already talked about mole. Now let's talk about these other ones. Basal cell carcinoma, a slowly growing papular nodule that derives from the epidermal cells. Keratinocytes. Metastases are rare, but are locally invasive. Can be quite destructive, especially on the face. Biopsy, excision, treatment. Tumor, according to tumor characteristics, curettage, electrical treatment, surgical excision, cryosurgery. So find out what the local treatment is in your area. Basic excise these lumps, send them off to pathologists for pathology. Good thing is they don't metastasize. Bowen's disease, it's a superficial squamous cell carcinoma in situ. Kaposi sarcoma is unknown prior to AIDS. We saw these back in the 80s actually. Here's a lesion, little dramatic black nodules with this lesion from 1990. Multicentric vascular tumor from herpes type 8 virus. So classic AIDS biopsy, and here's a treatment outline for you. Malignant melanoma. Well, we've been over this, so let's go over it again. Malignant melanoma arises from melanocytes, pigmented area, lentigo, superficial nodular area, metastasis. Yes, metastasis, first presentation of melanoma can be swelling in the neck, and then you're dead a few months later. Metastasis correlate depth of dermal invasion, treatment biopsy, wide surgical incision for operable tumor, metastatic disease requires chemotherapy, difficult cure, survival according to tumor thickness. Paget's disease of the nipple. You know, remember the Rembrandt painting? There's an abnormality of the nipple, one of Rembrandt's famous paintings, a rare type of carcinoma involving the nipple. Squamous cell carcinoma, you've got to know this one, very common. You know, in Australia we tell the students to roll up the sleeves of all your patients, particularly in the hot areas of the country, examine their arms and yes, their legs for any tumorous type or skin cancer conditions. Malignant tumor, epidermal keratinocytes, vasodermis occurs in sun-exposed areas. Local destruction may extend, but metastasis can occur in advanced case. Diagnosis, just look and do a biopsy. Treatment, curettage, electrodissection, surgical excision, basically remove these and send them off to the pathologist. Skin metastasis from a nasopharyngeal tumor, see, is metastasis to the skin, but this is very rare. Cornification disorders, again, this is an example of conditions of the skin you may not think important, but the patient does. Callosities, you get the pressure areas, hand, feet, particularly over deformed toes. Ichthyosis, a scaly condition, skin ranging mild, severe, maybe part of systemic disease, HIV. Keratosis pilaris, keratinization. Now, dermatitis, several types. Atopic dermatitis, immune related, IgE mediated, 5% of children in US affected. So, in other words, atopic dermatitis, very common. Pruritus, skin lesions are mild, severe, you diagnose a history and examination. Moisturitis are related to allergy, isn't it? So atopic dermatitis, common related to allergy. Contact dermatitis, very common. My God, this is what you got to know in dermatology, isn't it? And remember, a lot of conditions in dermatology are related to drugs, drug reactions. Common, 8% of all dermatitis, contact dermatitis, acute inflammatory reaction from irritants, allergens, pruritus, itching, redness, blistering. Diagnosis, you see it there. Local treatment, topical steroids, void, of course, exfoliative dermatitis, widespread erythema, scaly of the skin caused by pre-existing skin disease, drugs. Remember, drugs often cause a lot of skin conditions, malignancy, pruritus, swelling. Hand and foot dermatitis, a category of dermatitis of hands and feet. Lichen simplex chronicus, rare. Nubular dermatitis, choroidal disc-shaped lesions. Seborrheic dermatitis is really basically bad dandruff, high density sebaceous glands, you get it, cause unknown, seen in HIV, neurological conditions. Pruritus, dandruff, very distressing to the patient. Clinical diagnosis, treatment, all these, a range of medications based on a TAR configuration. Stasis dermatitis, that's basically where you get swelling around the ankles and get some redness. Fungal skin infections, quite common around the feet. Candida is the main culprit, infection with Candida. Skin folds, fat, big skin folds, itchy. Diagnosis outlined here. Treatment, drying agents, antifungals. Dermatophytoses, tinea barbae, tinea capitis, tinea corporis. You know, you get the fungal infection, symmetrical pattern around the groin, man, jock itch around the armpit, sometimes related to lack of hygiene. Fungal infections, clinical examination, steroids. Intertrigo, skin folds. Tinea versicollis, skin conditions with fur, multiple asymptomatic scaly patches. Now, hair conditions. Pseudofolliculitis barbae, painful areas of beard. It's beard hairs that penetrate the skin before leaving the hair follicle. Local treatment may be antibiotics. Alopecia baldness in men, difficult to treat, genetic. Some medications help. Alopecia areata, that's a patchy loss, no obvious cause, treat with steroids. Hirsutism, distressing to women. Exclude underlying disorder, check testosterone levels. Hypersensitivity and hyperinflammatory disorders, acute febrile neutrophilic dermatitis, sweet syndrome, tan to indurated dark red, papules, plaques, edema, cause unknown, steroids. Erythema multiforme, inflammatory reaction with target or iris skin lesions. Oral mucosa, diagnosis, clinical, related drugs, infectious agent, treatment, supportive. Part 3 coming up.